We'll never get to the gig on time now. I'll be able to play the bass tonight, right?
Sure, bud. I'll grab a bandage.
Irma Thomas? The Soul Queen of New Orleans?
Good evening and welcome to our American Town Hall discussion, the 100 Black Men of America, in partnership with Morehouse School of Medicine and NCRN Network. Tonight, this evening, we're going to be talking about, I'm over COVID, as we all are, but the issue is COVID is not over. It's been a war of attrition. We've been in this for a long time. Our objective here tonight is not just to have a candid, really conversation to show how this has impacted our lives. We want to learn this latest updates on Omicron and the variants from an ER doctor that's on the front lines. We want to recognize that all Omicron is less severe. It's still concerning, and be careful with that term. We want to understand best practices for preventing COVID as well as immune enhancement strategies, things you can do to help yourself. We also want to use best practice treatment options for patients who test positive for COVID, particularly during Omicron. I don't know how many people have approached me. I think at one time I had 65 people that I knew that were tested positive for COVID with this Omicron variant and really didn't know where to go. And most importantly, this is the most important part. We want to show that we connect. We want to hear testimonies from prominent Black leaders that you respect and trust and their experiences with COVID. When I say I am honored to be a part of such an esteemed panel of guests tonight, I hope that you enjoy it. My name is Dr. Eric Griggs. I'm the Director of Community Medicine here in New Orleans for Access Health Louisiana, which is an FQHC. I'm also president of the local chapter of the 100 Black Men of Metro New Orleans. I'm also the COVID advisory chair for the 100 Black Men of America. And again, I'd like to introduce my esteemed panel. First, I'd like to start with radio personality, DJ Lady Red. She's the host on 106.3 FM in Chicago. Hello, ma'am. How are you?
Hi. Thank you for having me. Can you guys hear me? Because I put my earpiece in. I don't know if you can hear the microphone. Can you?
A little bit more.
Did I take it out? Can you hear me better? Hello?
Oh, much.
How
Yes.
we do.
Okay,
Absolutely.
all right. All right. Then I'll keep that out. Thank you for having me. And yes, I am Lady Red from Soul 106.3, the Midday Mood Show, 10 to 3 p.m.
Boy, didn't she say that? She said it like, oh yeah, oh yeah, oh yeah.
So tune in. I'm a mood. I'm a whole mood. That's why we call it the Midday Mood Show.
A whole experience. Let's do it.
Yes.
We're also joined this evening by Congressman Danny K. Davis. He's the U.S. Representative from Illinois 7th District. Hello, sir. A pleasure to have you.
Thank you very much, and I'm so delighted to be with this esteemed group. And I want you to know, before I became the representative from the 7th District, I worked at the Mile Square Health Center and the Martin Luther King Health Center and used to be president of the National Association of Community Health Centers. So to see a health center person, that lights my fire.
I love it. Now, I'm going to tell you, you put all that pressure on me. I'm going to let you know I understand the assignment. I will do you well. I promise to do you well. We also have the pleasure of being joined by our esteemed chairman, our national chairman of the 100 Black Men of America, a leader and a mentor to us all, Mr. Tommy Dortch. Hello, sir.
Well, my leader, thank you. And I want to thank everybody for joining us today. This is so important. And as you said, and we keep saying, this pandemic is not over. So those listening in, please listen to all of the great panelists who are here. And we hope that what you hear today will not only help save lives in your family, your neighborhood, but will help you to stay healthy and safe. So I want to thank everybody for taking the time today. The 100's committed. And we know that so many partners, and of course, my great leader, Whenever I'm in the presence of the congressman, I feel I'm in the right place.
Thank you, Chairman. Thank you, Chairman. Thank you, Congressman. Thank you, Lady Red. Now, last but certainly not least, my esteemed colleagues, you give people praises when they're alive. And, as a mentoring organization, we mentor each other by holding each other accountable. It's Dr. Michael McGee. Dr. Michael McGee, MD, MPH, FACEP, ABCDEFG. Yeah, you do it. Yes. He's the chairman of the 100 Black Men of Chicago. He's of the COVID chair for 100 Black Men of Chicago, the chair of the ACEP Diversity and Inclusion Section, Firearm Violence and Injury Prevention Committee. He's the chairman of the 100 Black Men of America Violence Prevention Action Committee and the Vituity Emergency Medicine Methodist. But let me say this real quick. Now, I'm ashamed of you. He's one of the most dynamic physicians that you want to meet. Part of the reason that we're having this candid talk to our people is because Dr. McGee has been on the ground from day one. He can tell you stories from the hospital. He can tell you stories, his own personal stories, and that's the whole point of it, to connect so that you can see that even though we're on the front lines, we are you too, and he epitomizes every bit of it. Now that's enough. I don't need your bald head getting any bigger than mine, sir.
Thank you. Let's go right to the video.
Yes, please. Dr. McGee has put together a video, and from this we'll do some informational to catch you up on what's going on with Omicron in particular.
Greetings. My name is Dr. Mike McGee. I'm going to give you a brief update on COVID, particularly Omicron. Just to give you a little bit of background on myself, I'm actually an ER doc. I did a master's in public health at U of I in epidemiology and biostats. So I like numbers. I'm going to be showing you numbers and stats. So I urge you to take out your cameras and take pictures of important slides that I'm going to show you. I went to medical school at Rush, and then I did residency at NYU. So I'm going to go ahead and show you share my screen with you guys and give you a very good, interesting topic that you guys are going to get a lot from. And I only have 10 minutes, so bear with me. So as I said before, I'm an ER doc, but I'm also the COVID chair for 100 Black Men of Chicago. This is me in the ER. We're going to talk about how Omicron variant compares to all the other variants you've heard about. You already know that Omicron or coronavirus began February 2020. Initially, coronavirus is really the common cold, but it evolved into something else. It became SARS-CoV-2, which is basically severe acute respiratory syndrome. And this the second time we've had it. We had it 10 years ago when Obama was president. Just so you know, the way we became to get multiple variants is because when people are not getting vaccinated, they're not socially distancing, they're not wearing their masks, this thing becomes uncontrollable. And then because of low vaccination rates, it tends to spread more. And by the way, there are a lot of different variants. There are variants of interest, which is the Zeta, Eta, Theta, Iota, yada, yada. And there's also the variants of concern, which you all know about, starting with Alpha, Beta, Gamma, Delta, which killed a lot of people, and now Omicron. And by the way, the reason why Omicron is just so dangerous now is because it has 32 spike proteins, which is far removed from Alpha, which only had 11. And because of this, it's able to evade vaccinations and previous bouts of COVID from disease. We already know how COVID is spread, but we also should know that the Omicron becomes extremely airborne and can actually aerosolize and hang in the air. So within 15 minutes of you being around somebody who has Omicron, you can get it as well. And by the way, I made this up when COVID first hit to show the difference between COVID, the flu, allergies, and cold. And as we already know, most of the symptoms kind of evolved into one. And we had some of the same symptoms that, so you cannot tell if someone had the flu or a sinus infection or what have you. So particularly with COVID-19 and Delta, everyone had a fever, about 87%. People had dry cough. They had loss of smell or taste. Some people had GI symptoms. Some people may have had sore throat. But with Omicron, which really resembles the common cold, you can start out with a scratchy or sore throat, a runny nose congestion, a headache or head congestion. Some may cough. You may have fatigue, and some people have low back pain and also night sweats and may lose their appetite. One reason why Omicron is less severe because it does not normally infect the lungs. So you don't really get pneumonia. Most people don't. It may be limited to the upper airway, the nose, the throat, and the windpipe. To compare that to the Delta variant, this variant caused more damaging infections such as severe pneumonia and also caused breathing difficulty with low oxygen saturations and scarring of the lungs. And so this was significant because x-rays for someone who may have Omicron may be normal for most people. But with people with Delta or severe Omicron, due to their multiple comorbidities, they may have a lung that looks like this on the left, which case the person will oftentimes have to get intubated. And as you already know, once you're intubated, you don't do well. Although it's less severe, it's still a problem. It's more infectious and more easily spread. And it may spread easily because it's a high viral load in the upper airway. And so it becomes more airborne, as I said before. And also, we're finding that the rapid antigen tests are not as sensitive in detecting Omicron. And this is a view of that right here. As you can see, in the first 1 to 3 days, the viral load is very low. A PCR may detect it, but a rapid COVID test that's done here may not detect it. It may come out negative. And then once you reach day 5, the viral load tends to drop. And so after day 5, day 6, you can get a repeat antigen. And if it's negative, you may be able to go back to work. But some people still may have a detectable load due to PCR. So the bottom line is, don't always expect that the rapid test is going to be, if it's negative, that it's going to be accurate. You may need to quarantine for a day or 2 and then repeat the actual rapid test. And in regards to it being less severe, it's really very contagious. People not vaccinated may get it. People who are vaccinated times 3 and have had the booster may get it, but oftentimes they don't get real sick. They don't have to go to the hospital, and they don't usually die. However, people who are not vaccinated, which there are a lot of them, still will get sick, hospitalized, and die. Also, the youth, as you can see here, and really kids under 5 are really at high risk because they can't wear masks and they can really get infected. And as you already know, Black and brown people, because of all of our multiple comorbidities with hypertension, diabetes, we tend to not do well. We already know that Black and brown have a 4 times risk of being hospitalized as compared to a white person and have a 3 times risk of dying. And so we have to be careful. Initially, when Omicron came, it was only 1%, but then by December 18th, it was 73%. And now we know that it's the dominant variant right now, which is at 94% at the beginning of January, but now it's probably 100%. As you also know, you also can get the flu and coronavirus called flurona. Just to show you this, these are the cases that we have now in January. And these are the hospitalization deaths that have gone up. And to get even more specific, this is where we are January 19th, and this is where we were in 2021. Very high peak. Again, this is hospitalizations right now, and this is back in January of last year. And this is another good picture showing you how it was in 2020 with hospitalization when they first hit, and where we are now. The highest has been since Omicron or since coronavirus have been here. In regards to kids, these are kids less than 5 who are being hospitalized. These are kids, youth, age 5 to 17, who are still being hospitalized. And this looks at the number of people who have gotten a booster. As you can see, only 24.8% of the country have been fully vaccinated with a booster. So we have a way to go. Looking at the USA in terms of deaths, we're at 880,000 people dead on January 20th. That's a travesty in itself. And looking at Illinois, we're 7th, and my city and state is Indiana, we're 14th. So we have a way to go. And just let's focus on Indiana for a minute. Indiana has the worst state for COVID safety. In fact, 99% of patients who are hospitalized or dying in Indiana are unvaccinated. And this is showing you a comparison between Massachusetts and Indiana, which has the same number of cases. But as you can see here, the number of people in Indiana are dying way more than the number of people in Massachusetts based upon their vaccination rates. Prevention and treatment. Well, take a picture of this. This shows you what 100 Black men of America are using to enhance their immune system. This is another snapshot you should take showing what you should do if you get COVID. You should definitely check your vitamin D level. and take high dosages. So take a quick snapshot before we move on. Again, you know how to protect yourself. We've been telling you all along to get vaccinated, to ventilate, to maintain distance, to wear a mask. Not just any mask, but a very good mask. And this is basically showing you, even though it's a low chance of you getting pneumonia or low O2 sats, you still need to check your oxygen saturations if you get infected. So please keep that by you. And as a matter of fact, really COVID Omicron variant is like the simple cold. You can really get by just taking NyQuil to take care of the symptoms you get, which is runny nose, headache, fatigue, sneezing, sore throat. And you don't have to go to the ER. Also, please get a KN95. These are high quality masks. They're very comfortable and they're very protective of you. And also, please get boosted. This is our very own 100 Black man brother, Duro Denard, being boosted at our facility about 3 weeks ago. And in terms of treatment, we used to hear about monoclonal antibodies being very effective against Omicron. Well, it's not effective now. They do have a new type of monoclonal antibody out called Trovimabab. It's hard to say, but it's been found to be very effective at treating Omicron, results in an 85% risk reduction in hospitalization as well as death. But it's hard to come by. And right now, we're still waiting to get more in. We've heard about Paxlovid, which is an oral medication. You have to take it within 5 days of symptoms. It's shown to be very effective as well. And again, we're still lacking in getting the production done. So hopefully by February, we'll have more. So help is on the way. But the bottom line is get boosted and protect yourself and your family and do whatever you can to not get it by wearing the proper mask. So this is Dr. McGee. We'd like to thank you for listening to me. And we will go ahead and end at this point. Thank you.
Hey ho, let's go. I'm Dr. Mark Allenderry, and I'm an infectious diseases doctor and epidemiologist.
And I'm Doc Griggs, and I'm a community health specialist. On this episode of COVID Noise Filter, we're talking about COVID vaccines and variants.
So you meant to snap us into some three little pigs' tale?
Watch and learn. Imagine your body is like a house, and COVID-19 is trying to break in. Antibodies created from vaccines are like your security system, recognizing the intruder and destroying it. But viruses are smart, and they mutate, putting on new disguises to bypass your security system.
Even if you're vaccinated, COVID-19 variants will emerge and transmit, and your antibodies will have trouble recognizing them.
That's why we need a booster shot.
mRNA vaccines help your immune system recognize COVID-19. When the virus mutates, the booster shot provides updated antibodies specifically designed to fight these new variants.
Basically, we need to update our security system to keep out these new nasty neighbors.
That's a wrap on today's episode. Ready to roll?
Dude, please, no, please don't.
So
Nice.
thank you for that. I hope all of you are smiling. Dr. McGee, I really, really enjoyed your presentation. And that cartoon at the end, I recognized at least the voice, or I didn't know I looked like that. But we hope this has done is help to demystify some of the stuff that's going on. And you saw at the end of the cartoon, it said to be continued indeed. And as always, throughout this pandemic, the 100 Black Men, we will be here with you. And we want to make sure that you understand we literally are with you. Dr. McGee, we talked about the number of cases of Omicron in some parts of the country are going down, like here in the South and the Northeast. But then there are some places that have, as of yet, to peak. What are your thoughts on that?
Well, the cases, we all know that most cases, as we said, are mild. But however, you got more people getting infected. And we already know that there's a 2 to 3 week lag on people dying. That's what's important. Not so much the cases as the people that's dying that's greatly affected. And so we now know that today we are at 890,000 people dead since 2020.
Can you say that number
And
again,
with
please? What that number?
890,000 people dead.
And how
since
many thousand
2020.
people a day? How many thousand a day?
Right now, just 4 days ago, it was 2,000 people dying a day around the country. Now there are
2,000 people a day.
2,200. Now there are 2,250 people dying a day. That's how
This is right
thing-
now. Right now,
This is-
2,200 people
this is-
dying every day, and you have people that are saying that it's mild and that are debating about wearing a mask and getting vaccinated. I'm sorry, Doc. I just want to hear from you. You know, I'm just saying, numbers.
So it makes no sense, right? Because think about it. If we're at 2,250 people dying a day right now, in the next 5 to 6 days, we're going to be at 1 million people dead.
Now,
So
folks,
this
for
is-
just a little context with that, the virus, the HIV virus, has been in this country for 40 years. We celebrated it World AIDS Day, that we made a lot of strides and progress, and it was very serious. In that 40 years from HIV, we've lost 750 to 760,000 people. In 2 years, we're at 890 and we'll be at 1 million. And people want to pretend this is something to joke about, or that it's not real. I'm sorry, Dr. McGee.
Well, you're 100% correct. And here's the deal. We all keep hearing that it's mild, but for some people, it's not mild, right? For anybody unvaccinated, you still can get pneumonia. You still can have pulmonary embolisms. You still can have other issues that can make it complicated. But most importantly, remember the people who died initially when COVID came. These were the people at risk who have high morbidities and high pre-existing conditions, like Black and brown people who have hypertension, diabetes. We have immunocompromised with cancer or HIV. We may have morbidity in terms of obesity, which is a major risk factor. We have lung disease. We have sleep apnea. Those are things that can also make this disease not be so mild. And not to mention this, who is the one population that can't wear masks and are not vaccinated? Kids under 5. So if you get sick and you have a simple cold, now you're around somebody's baby or your own baby, well, they can get it. I sent out 3 kids from my ER. One was 2 months, one was 7 months, and one was 7 years old, who all came in respiratory distress, who had COVID. This is the reason why we got to protect others. If we're not so concerned about ourselves, it's the other loved ones in our life.
So, Doc, quickly, I want to, you kind of touched on it. I want to talk about our immune enhancement strategies by the 100, but also there's a common question out there. How is it that COVID seems to affect everybody differently? I personally, my aunt has COVID, her mom has COVID, my uncle does not, neither does my cousin. They all live in the same house. How is COVID affecting everybody differently?
Well, there's several factors. One, if you have a good immune system and you eating the right food, you in shape, you taking your vitamin D levels and they're adequately elevated, you have good protection. Also, if you are type O, and these are all the studies that showing that people with type O blood are protected from severe COVID. A lot of those people did not really get sick, but if you're type A, you're more at risk of getting sick and having complications.
Say it again,
A lot of
Doc.
people don't even know what their blood type is.
I want you to be clear with that. You won't be as severely sick. Type O blood does not give you a Superman outfit or a Wonder Woman outfit and make you immune to COVID. Correct?
Right. But what it does
I want people to go outside,
this-
buy
this-
T-shirts and put a big O on it and think they're good. We're not doing that.
Well, they looked at studies. We've had enough people to die and not do well from COVID. And they looked at who does well. People with type O tends to do well. It's an unknown mechanism behind it. People with type A tend to do worse. People who are type AB are in between. And so you just never know. And there are a lot of people who had COVID who had nothing, who never even knew they were infected.
So
that's thing to
real
think
quickly, can we talk about our immune enhancement strategies and the therapeutic doses of vitamin D that we talk about with our Healthcare 2.0 with the 100 Black men? And then I want to get to some of our testimonies to do the real talk from the real experts.
Of course.
as they survive.
So basically, again, these are studies that were done even before COVID. They show that vitamin D levels, adequate vitamin D levels, enhances your immune system. And so if you're in the sun a lot, you're going to get your vitamin D. But what happens during our months here in the Midwest? We have winter. We're not outside. And so some people's vitamin D level are down exponentially, meaning it has to be more than 40. A lot of people are below 20.
And so we'll take 1,000, 2,000 units of vitamin D, but we're never getting up to that 40 number to give us the adequate vitamin D level. So I encourage people, check your vitamin D level, see where you are. And if you're down, you should be taking 50,000 units a week.
You mean as a booster,
in order to get your
right?
numbers up.
Sound familiar? As a booster. As a booster.
Exactly. There's also vitamin C, there's turmeric, there's just
Zinc.
eating the right food. Zinc is in there. And I gave you the picture. So if you go and watch this video, you'll be able to take that snapshot and know what you should be doing.
But most importantly, folks, we want you to get enough rest. Rest is key. Even if you get infected, and you're going to hear the meat of the meal is coming up with our testimonials. Rest, adequate water, healthy foods, and exercise are things that we try to do, and we try to encourage. Now, I want to talk about the meat of the meal, and y'all saw how I slid that in there, right? Yeah. Mm-hmm. Lady Red, I've done this a time or two. What I'd like to do, in the community, we talk about COVID and we hear the numbers, but we don't hear the stories, the real stories behind the people. A lot of people that might seem familiar to you. We have a video of an R&B singer, Jeremiah. He caught it in the first phase of Omicron of COVID in 2020, where over 500,000 to 600,000 people lost their lives. So I'd like to show you the reality of what COVID can be. Thank you, Jeremiah.
Southside native tells me in his 33 years of living, he had never been treated at a hospital. He considered himself to be very healthy, but everything changed last month when he was placed in ICU due to COVID-19. He says he wasn't sure when and at times if he would make it out alive. A singer, producer, and Grammy-nominated artist, Jeremiah is best known for his music and always showing his hometown some love. Girl, you know I'm from Chicago. But last month, the Chicago artist was trending for something he never could have imagined. He was fighting for his life, battling COVID-19. Today, he's ready to share exactly what happened.
It's very real, and I had to go through it, and I hate for anybody else to have to go through that as well.
Jeremiah says days before he was hospitalized, he realized that something about his body felt off.
Thinking back, I knew I was like dehydrated, and I might have just thought I had a cold, and I was just taking some NyQuil.
From there, he says all he can remember was one night waking up in the hospital, unsure of where he was and what happened. His diagnosis? Complications due to COVID-19. And as a result, his body was suffering from multiple inflammatory syndrome, a condition that causes major organs to become inflamed.
My heart was just beating irregularly. My liver and my kidneys were out, and I could talk about this now, because thank God I've made it and I'm still here. But, I was on dialysis. They kept telling me that the numbers weren't getting any better.
Jeremiah admits that there were times he thought about giving up. He wasn't sure if he could fight anymore, but he thought about his mom and his 2 boys, and he knew he had to keep pushing to survive.
When a lot of people, especially like young adults, heard about you being hospitalized, some of them were like, okay, COVID is real. Because Jeremiah is in there. COVID, this is serious stuff.
If I had to be the example, I'd take it, because a lot of people might just be taking it for granted, still out partying and just around amongst their friends and just not thinking that, it's real. It happened to me, and I just happen to have been one of the very few who made it.
The singer says he had to learn how to walk and eat again in therapy.
I wouldn't wish that upon nobody, to go through what I went through.
Today, Jeremiah says he feels much better. And as he continues to recover, he isn't in this alone. Chicago's own Chance the Rapper has been fighting with Jeremiah every step of the way.
This is one of my best friends. He knows my family. I know his family. So yeah, we were all affected by it.
The 2 artists now.
So wow, I just want to let that sit with y'all for a minute. This is a 33-year-old, healthy, vibrant, young Black male. COVID has no biases. COVID doesn't care about your religion. It doesn't care about the party. COVID doesn't care about the fact that it's a holiday. It doesn't care about your relatives. We're in a fight, And the best things we can do for ourselves is to educate ourselves. And of course, Doc, I want you to back me up. Everyone on here will back me up. Please get vaccinated. Get vaccinated. Get the booster, get the rooster, get the hen, the turkey, take all of it. The studies, the data shows, Dr. McGee said it, he sees it firsthand. I hear it from my colleagues in the hospitals. There's a noticeable difference between people that have had 3 shots versus 2 shots, 1 shots, and the most severe, the one that's occupying 90 to 95% of the hospitals, is those that are unvaccinated. I'm not going to belabor that point, but we're going to, as a family and a group, keep belaboring the point together. Please get vaccinated. We heard about Jeremiah, and we know, I mean, at this point, 2 years in, we are over COVID. I pray I never meet someone that named their child COVID, because I don't know what I'll do. I might just take off, start running down the street. But the problem is, like I said, COVID isn't over us. I want to hear from our Black leaders, prominent Black leaders in the community, about how COVID affected them. And folks, I think you will be as awed and revered and hopefully compelled to help spread the message that we need to get vaccinated, wear masks, and protect ourselves. I'd like to start with Congressman Danny Davis. I'm trying to make sure I impress him because I got my assignment, my marching orders from the healthcare community. Congressman Davis, as a public official, first of all, thank you for joining us. But as a public official, I want to hear your story, your personal story, and some of the things that you're doing around Chicago to promote trust and vaccinations in the Black and brown communities in Chicago and around the country. But please, can you give us your testimony?
Well, let me just tell you, growing up in rural Arkansas near Louisiana, we were taught early in life that a little knowledge is a dangerous thing. My daddy used to say you got to drink deep because shallow drinking intoxicates the brain. So I want to thank you and Dr. Griggs and all of these professional scientists for the concrete information that you have given us. I also want to convey the same kind of thanks to Brother George and the 100 Black men for spreading the word, because having knowledge, if people don't get it, it doesn't help them. Lady Red does an outstanding job, but let me tell you, individuals can do a lot of things themselves. Personally, I've got on my dresser a box of self-tests. I'm known as a workaholic, honest to goodness. I've always been that way. But after these doctors tell me about getting a little bit of rest and listening to that, I'm actually getting more rest than I normally do. I try to make sure that I go to bed a little earlier. We've been fortunate in Chicago and Illinois because lots of people have just done things themselves. My staff and I have distributed more than 50,000 masks during the last year. We've also vaccinated or gotten vaccinated with volunteer doctors, nurses, technicians, most of them are African American, most of them Black, not all, but most. And this has been done in a volunteer way by people. Churches have opened their doors, community centers, and yeah, it's good for people to be tested, but I tell you what, it's even better to be vaccinated. I mean, being tested is important, but this ounce of prevention is worth much more than a pound of cure. And if we can get that message conveyed to people, our people, we're still having problems. I mean, we still got some low numbers in many communities throughout the country, but I am so pleased that they are coming up, that people know that we are not finished, that they know that we got to keep driving and never stop. So I want to thank again all of you who are on this call for the outstanding work, and all those volunteer physicians and nurses and people that we work with on a daily basis, the ministers who open their churches, and the docs that we have every Monday night. We do something every Monday night called Chat with the Doctors. And we always have 6, 7, sometimes 8 Black doctors, African Americans, telling people that they got to get vaccinated. So carry on. It's great to be a part of this discussion. And I'm just having a wonderful time.
Well, thank you, Congressman. We really, your words go deep in a very good way. We're blessed to have you here with us. Now, do you have a personal story with COVID?
I have tested positive, and of course, I'm a big funeral going guy. So I mean, I don't think a week has gone by that I have not gone to 2 or 3 funerals. As a matter of fact, next week I'm going to my brother-in-law's funeral. So I tested positive, but I didn't have any symptoms. And I always say, and immediately I ran to the health center the moment I heard and got tested again. I ran right on over to the Mile Square Health Center. I was coming from another event and got the word. And so I've been just fine. Haven't had any problems. But yep, follow through, do all of the things that must be done. We can lick this, and we can't let it lick us.
Thank you so much. Thank you, Congressman. Folks, I hope you're hearing the message. Not only is he on the front line doing what he can in the community, he tested actually positive. And remember that we talked about, COVID affects everyone differently. Lady Red, I understand that you weren't hospitalized for a long period of time, but I understand you had a horrible experience.
Yes, it was the worst days of my life. I'm typically not a sick person. I don't take off work for, being sick, vacation, stuff like that, things that happen, with life. But I had been COVID free for the entire time that they had announced it, 2 years. Not until the end of 2021, December, did I get sick. And it was so different. Dr. McGee and I had talked after I got well, and what I didn't know is I had started having these back spasms because, it wasn't mentioned that back spasms was a part of it, but I had started having these back spasms and they would come and go maybe like for a couple of days. So then after the back spasms, I started, getting like a runny nose. And I'm like, okay, wait a minute. But it wasn't enough for me to say, hey, I'm sick. Maybe it's just, I'm catching a cold. So after the runny nose, the next day came with a scratchy throat. It felt like rocks was in my throat. And I went to, urgent care and they like strep throat. And I'm like, okay. But then after the strep throat, I was tired. Like I had got off work that Friday. I could not, stay up. I'm typically, I stay up, I'm a night owl. I went to bed about 5 o'clock in the evening and I just was unbelievably tired and with the scratchy throat. And so I'm like, let me, lay down. The next day I woke up, I started with a little cough. My nose was running. My body was aching. I had chills. I started feeling lightheaded. Everything was just happening. And I said, okay, I hope I don't have COVID. I haven't been around anybody, but when I started feeling lightheaded, had no appetite, I said, let me go, get checked and tested because this is not a normal type cold. I mean, like to touch me, like if someone were to touch me, that hurt. Walking on the bottom of my feet, it hurt. And I kept thinking I was going to pass out. That's how lightheaded I was. So I'm trying to find an appointment. Couldn't find an appointment nowhere. Look in Indiana, look Illinois. So I drive to a couple of places where I know that they were testing. Lines are down the block. And so I'm Dr. McGee, Hyde Park Urgent Care Facility, only Black urgent care facility that we have. I said,
Superhero.
yes. So I said, let me go, and try to get, an appointment at the urgent care facility, because every time I go, I never have a problem. So I went there, got right in. Now, Hyde Park is maybe like a 25-minute drive from my house. So, but I drove, got in the car, and I tell the lady, when I get there, I'm like, I think I may have COVID. I'm having all these symptoms. But the one symptom that I did not have was a fever. They checked my temperature, did not have the fever, but everything else on the checkbox I have. So I get there, Dr. McGee, he sees me walking in, but I didn't say anything to him. I saw another physician, and, she tested me. I tested negative for the rapid test at least 4 times. So it was saying that I didn't have COVID, but Dr. McGee came in like, wait a minute, her blood pressure is low. I couldn't breathe. It felt like someone was standing on my chest. Every time I took a breath in, it hurt so bad. So they did an x-ray of my chest. I had pneumonia along with COVID. They saw a mass, and that oxygen tester that he put on my finger, my oxygen levels were like 90. And he said, like, typically if it was 89, I would go to the ER or whatever. So he had me buy one of those. But while I'm there, I just was out of it. I was dehydrated. So Dr. McGee gave me IV, and then they did the PCR test because all my COVID tests kept coming back negative. So once I got home, of course, 2 days later, the PCR test said, you have COVID. But the lightheadedness was unreal. Like, I thought I was going to pass out. I felt like I was going to die. And so Dr. McGee, prescribed some, antibiotics and drink a lot of water. I lost 17 pounds in a matter of 5 days.
Now, folks, that's not the diet you want. Now, I see some of y'all out there making that face. I can see you. Y'all don't know. We can see you. No, this is not the way to do it. This is not the way to do it.
And that scared me too. And so, Dr. McGee, I thank God for Dr. McGee, because he's like, you need to go to the ER because, you lost 17 pounds and you're not able to breathe. So I went ahead and went to South Suburban Hospital. They gave me, IV. They say I was dehydrated, and, I didn't feel better until maybe 7 days later. I know they say 5 days in, 7 days later, I started to feel better. But after the 5 days, I started throwing up. Like, it was a course of symptoms that kept coming. And when I tell you, I just felt all I could do was lay down in the bed and just pray to God. I thought I was TD Fakes. I had prayed so much, because it was unbelievable. And I'm not a sickly person, but I was taking the fluids, and then the vitamin D, turmeric, zinc, all of that. I started that regimen. I started feeling better, but I still feel like there's some some things that's still lingering on after I'm better, because I find myself often clearing my throat. There's this kind of like a little after cough, so to speak, that haven't went away. And I'm so tired still, even though I get rest. So this thing is real. And when I hear people saying that this is fake and all of this, like he said, 809, you mean to tell me that 890,000 people were just going to die just because? And, people out here still thinking that this COVID thing is not a thing. And everybody in my family was vaccinated. And I'm ashamed to say that I was the only person that wasn't vaccinated.
I was about to get you. I was about to ask you that question now. Bring the thunder now.
Yeah, so I was not vaccinated, and it was the worst thing on earth. My sister caught it, not from me. My nephew caught it, who's under 1. He caught it from the daycare, and he, passed it to his mom and his dad. So my sister vaccinated. She had symptoms sort of just like a common cold. She didn't, and maybe like chills or whatever, what have you, but she was not what I felt like on the brink of death, like how I was. And, my nephew who tested positive around the same time I did in December, it's now January, 27th. He's still testing positive from December, and he's a baby. But everyone else who caught it, our stuff is coming back negative, but the baby's still testing positive, and my sister didn't catch it as bad, and she's vaccinated. So I dropped the ball.
Are you on the train with us now? Yes.
I'm on
yes?
the train. I am driving the train. Okay.
All right.
I'm the conductor.
All right.
Watch the closing doors, because it was the worst thing ever.
I hope you're paying attention to everything. That was such a densely packed testimony. There is so much to be said about the way COVID responds, the importance of vaccines, transmissibility, infection, and being able to pass it on from kids and to kids. There was a lot. Now, what I hope you're watching, Chairman Dortch, I saw him over there. There were certain things, especially when she said lightheaded and the feelings and the whole nine. Chairman Dortch, can you please share with us your experience with this? Folks, not only are we COVID advocates, people have experienced this thing. So the true experts. Right. Chairman Dortch, please.
Well, Dr. Griggs, one of the things that I always do is follow instructions. And the Health and Wellness Committee told me to take 10,000 units of D3 a day. I've always done that since I got that advice. I take zinc. I do vitamin C. I take black elderberry syrup. I do those. I wear my mask everywhere, even at my home with my grandchildren, and I stopped letting them come as often because, one, I also have type 2 diabetes. It's under complete control, control it quite well from diet. But, I took the extra steps in that. But on December the 27th, I was having my board meeting at home. And one of my companies is made up of my son and daughter and my wife. And so we were having a board meeting, and they were bringing their children over to spend the night, which my requirement was, one, everybody had to be vaccinated. Everybody had to have a negative PCR test before they could come to the house, or otherwise they had to participate in the board meeting virtually. Now, my children don't miss the board meeting because they like their year-end dividends. And so of course, everybody took the protocols serious and did it. And I thought, well, if I'm having this done, let me just I have all these home tests as well. And so I took one of the home tests that I keep several of those around too. And the first time it came up positive. Waited a few minutes, maybe about 30 minutes, took it again, it came up negative. And I became concerned. And so what I did was, again, everybody in my house, it was here, had to have the mask on. And my daughter-in-law expecting a baby on my birthday. So, I take it serious. Oh, yeah. Nothing's going to happen to my granddaughter. They just revealed it's going to be a girl.
Congratulations.
My granddaughter. So I called the company that I worked with. By the way, for 10 years, I chaired the Fulton DeKalb Hospital Authority that owns the Grady Health System. So I chaired that authority. So I have access to doctors, not to mention with the 100 Health and Wellness Committee, the best list of doctors in the world. And so I had them come to my house, and they did an antigen test on everybody and took the saliva PCR test. They have those sent off so we get the answers the next day. And my wife and I both tested positive, even with the antigen test. But I began to trace back as to, because, I'm overly careful. When I get up, if I walk out my door, I put my KN95 mask on, my N95 mask on everywhere I go. And when I traced it, only to find out of all the places you would expect to be exposed, the nurse in my doctor's office came down with COVID. And I had just been in the doctor's office for my end of the year exam. And I've been working on, and this is important, I've been working on her for probably 2 months, saying you need to get vaccinated. If you won't do it for yourself, do it for your loved ones. I've worked on it. She went through holy hell with COVID, but when I did the tracing, I found out she had COVID, and the doctor's office called me. But this is the important thing. I had 0 symptoms to this day. I mean, I've tested negative because I kept testing every week. I said, so, but I had zero symptoms. I would not have known I had contracted COVID had I not just decided on my own to just test. Now, I got both of my vaccine shots in January of 2021. 3 months ago, I got my booster. And by the way, if they come back with another booster, I'm taking it. But I had no symptoms. And my wife had no symptoms. She got hers early 2021, a shot. She was due to go that Friday to get the booster, and that was right before she discovered she had it. But I say to everybody, the good thing, none of my grandchildren, none of my children or my daughter-in-law, none of them had it. So we still follow protocol in-house with the mask. And to this day, I tell everybody it's very important. We have to get the test, get the vaccines. We have to wear our mask. We have to do social distancing. And if you won't do it for yourself, do it for the people you love. And that's the thing that people have to understand, that it's not just about you. And it only takes minutes. I was in my doctor's office for 1 hour and I was infected. And my mask was on almost the whole time. It may have been, if it was for 10 seconds, it may have, again, I even wonder how I got it. But as Dr. McGee said, lingers in the air. And so I was fortunate. I wouldn't go to try and see what the symptoms would be if I got it again. But I do know the instructions that you guys gave. And after it came up that I had been infected with the test, I went to 25,000 units of D3 every day. I do those 5,000 chews that you guys got us on, the D3 chews. I take those, turmeric, I mean, you name it. If it boosts my immune system, I'm doing it because I want to be around here when my new granddaughter arrives on my birthday of April 12th. But more importantly, I want to be around to keep joining my brothers and sisters who are working to make our community safe. So it's very important, but I'm here to talk about it. But the good thing is my experience is nothing like I've heard from so many people who've been impacted by COVID. And this thing is far from over. So we can't let our guard down.
Thank you, Chairman, for that testimony. Lady Red, thank you. Congressman, thank you so much. Folks, the time has really flown, and we would love to do this again and share the real stories. You can go to our website, 100blackmen.org. For more information, follow us on Twitter at 100blackmen. Again, 30 seconds apiece. Can you please, I'd love it if you just close it up for us. We'll end with you, Chairman. Congressman Davis, can you start?
Well, just make sure that you practice all the public health protocols that we know work, and we're going to be all right.
Thank you, sir. Lady Red, thank you again for that compelling story. Wow. Ooh.
Yes. So because of that, people, be responsible. You have loved ones that you have to look out for. It's not just you. And I thank 100 Black Men of America for the preventative measures that you put in place, because no one is talking about how to boost your immune system. So follow those protocols, the vitamin D, the zinc, the turmeric, and what else? What is the other?
Elderberry.
Elderberry. Yes. Follow those protocols, because no one talks about the preventative part about it. So make sure you're taking your vitamins to boost your immune system, because this thing is real, and just be responsible. Please be responsible.
Thank you, Lady Red. And my grandmother always told me to give people flowers while they're alive. Superhero, frontline, ER doc, epidemiologist extraordinaire on the microphone, the video, you name it, you got it. Dr. McGee, please give us some words of wisdom before our chairman closes us out.
He saved me.
Guys, awesome job. I just want everybody out there listening. No one is immune to this for the most part. You may have no symptoms. You may have a little symptoms. You may have in between symptoms. You may go to the hospital, but most of the studies showing that the people who go to the hospital who are dying are not vaccinated. It's about 95 to 96%. I actually have my confession. I'll be quick. I was diagnosed with COVID. I spent Christmas and New Year's looking at videos of my daughters opening up their gift. Even though I'm a type AB, I eat the right food, I exercise. It hit me because I have history of sleep apnea that I was just diagnosed with, and I was having bronchospasms and using breathing treatments and was just sleeping the whole time. And while doing this, I was still giving advice to people like Lady Red and other people who had caught COVID and who came to our urgent care. So I was still trying to do the mission, but it's like everybody says, you wax and wane. 1 minute you feel good, the next minute you feel horrible. And I too had back pain initially and didn't know what I was having. And by the way, long haulers, which is what Lady Red was describing, is when you have symptoms after you've been negative, still exist. And it can exist up to 3 months to 6 months later, where you may not sleep. You may have GI symptoms. You may have chest pain. You may have fast heart rate. You may have fatigue. You may not be able to jog as many miles as you used to. So you still may have a lot of symptoms. And there are a lot of people out there with long hauler symptoms. The final thing, just because the cases are going down, there's another variant of the variant. Right now, Omicron is BA1. We now have BA2. And it's even more infectious, about 1.7 times more infectious than Omicron. And you guys know Omicron was 70 times more contagious than the initial COVID. So it ain't over, man. It ain't over. I'm tired of seeing kids dying, man. I'm tired of seeing grown folks and elderly grandmothers coming in who were fine a week before, now come in kidney failure, pneumonia, and then dies 2 days later. We can't have it happening. It can't be happening disproportionately like this with Black and brown communities. We got to stop hearing the nonsense that's being spread on social media and do what we need to do, man. Because every one of us knows somebody who has died, who was a friend or a family member. So you guys know it's real. So do the right thing. We all care about you. We love you. That's why we're doing these things continuously. And we know you're tired of hearing about it, but it ain't over. Thanks a lot, Brother Griggs.
Thank you,
And
Dr.
if you're sick,
McGee.
stay home. If you're sick, stay home. No matter if it's COVID or not.
Please stay home. Thank you for that. And Lady Red, thank you for that. Please, it doesn't get any more simple than that. If you're sick, stay home. Listen, it's been my pleasure to be your host. I'm Dr. Eric Griggs, the National COVID Advisory Chair for the 100 Black Men. I must admit, I had COVID early on and did not have one symptom. Didn't know it until I took my first shot, my first vaccine, and had the reaction you should have to the second one. COVID can hide in any way. We're going to be here. Our messaging won't stop. Chairman Deutsch, will you please take us home?
Let me thank our phenomenal panel. You all make a difference in our lives, whether it's on the airwaves or in Congress. And we want to thank you for that. And I can't say enough. When I asked Dr. Griggs if he would chair our COVID task force and our whole initiative national, he didn't hesitate. Very busy man. When I asked Dr. McGee if he would chair our violence prevention task force, he didn't hesitate. Dr. Mark Alexander, who chairs our overall health and wellness, didn't hesitate. And we have several doctors in the 30s and practitioners that takes us over 40 who work every day, and they have the passion for taking care of our community. So I want to start by thanking them for their leadership and thanking each of you. I want to thank all of our chapters, because throughout this country, our chapters continue to do testing, continue to feed, and will continue to feed our neighborhoods, folks who don't have access to food. We do vaccination clinics throughout this country, taking them to our community. We thank our partners from Pfizer to the folks from Walgreens and Walmart and Morehouse School of Medicine who have been partners in this effort. But we're committed to our communities, because if we don't take care of our communities, nobody else will. And by the way, the other thing that I've done for 16 consecutive years, I go get my flu shot every year.
Yes.
I don't take any chances. I haven't had pneumonia. They said, knock on wood, in the 16 years that I've done this. But it's all about us taking advantage of all of the great discoveries and the services that are out there. We've been vaccinated since the day we were born on this earth. And so with that, thank you all. For those who are listening, please visit our website. You will hear more and more. Visit our chapters. We're here to make sure we do our part. You can't blame somebody else. I can't understand why folks will protest having to be vaccinated, protest wearing masks. If you won't do it for the ones you say you love, do it for the people that you impact. So with that, you'll hear more and more from the 100 Black Men of America, from our health and wellness. And don't forget too, violence, as Dr. Satcher said over 2 decades ago, was one of, if not the greatest health challenge to our communities. We got to address these issues because mental illness and so many other things are an outgrowth of what we're seeing from this pandemic. It has expanded what we're seeing, but we're going to be there, and we want all of you to join us as we take care of our community and understand children aren't born bad. They learn bad behaviors from adults. Thank you for joining us, and please, let's work together to save our communities and keep a healthy community.
Well said.
Thank you.
Teamwork.